Hello friends, I'm Sarah Bond, founder and CEO of Philadelphia Family and Mainline Parent, and today I am here at the Art of Pain Management Philadelphia, and I'm pleased to introduce you to one of the most successful interventional pain management practices in the Philadelphia area. So the Art of Pain Management in Philadelphia provides patients with interventional treatments to manage their pain and their lives. The Art of Pain Management has largely used this treatment on patients with osteoarthritis, degenerative joint diseases, and other things that are their biggest focus, which you're going to hear about in a moment. So this is my first time visiting Dr. Teller, and I'm going to turn the camera around to introduce you to him, as well as Jerry Penders, who is a patient care advocate at the Art of Pain Management. And we're going to give you a little look around the office here, learn about the products that they use to help their patients. And if you have any questions throughout this presentation, please feel free to pop them in the comments. We will have time for a Q&A. And stay tuned because there will be a special offer for our viewers at the end. So I'm going to turn us around and say hello. So this is Dr. Teller and Jerry Penders. So, Dr. Teller, I understand you have a background in chiropractic care with degrees in physiology and kinesiology. And then years ago, you partnered with Dr. Michael Skina, who's a vascular and general surgeon, to build this practice.
Yeah.
Can you tell me, what is stem cell therapy?
So let's start back 10 years ago when we started interventional pain management. We started doing, mostly spine injections. You've probably heard of epidurals, knee injections, hyaluronic acid injections for osteoarthritis. And what we see is patients feel better for a couple weeks, if not a month, and then the condition sort of comes back. So we developed programs for yoga, swimming, tai chi, anti-inflammatory diets, vitamin and mineral programs, and the patients were actually doing a lot better. Pain relief was a lot longer. They were getting better functionality in life back. But stem cell therapy has always been sort of taboo, sort of, not researched as much as it should be in the United States topic. And when President Obama left office, he passed the 21st Century Cares Act. And that act allowed us as physicians to start experimenting with non-FDA approved stem cells. So, as we know, FDA has approved stem cells for blood-borne cancers. So when you treat leukemia now, you get treated with leukemia by stem cells. So, and that's very successful. So we started using it for osteoarthritis. Maybe 2.5, 3 years ago, we went to Harvard University, started going to seminars and educational events on stem cells. The procedures we're doing in the office has been going on, in Germany and Spain for 10 plus years. And even China, frankly, has had some pretty good research on stem cells. So in the United States, we use ethical stem cells, right? Harvested from natural-born delivered babies, right? You can harvest cord blood and then harvest stem cells from there. Amniotic fluid that the baby sort of floats around in the mother's womb, you can harvest stem cells from there. You could also harvest stem cells from bone marrow, which we do in this office, where we basically stick a screwdriver, a very, very skinny screwdriver, into your hip bone or your femur, and extract the bone marrow stem cells, which we can then spin and re-inject them back into joints, spine, hips, shoulders. And now we see patients actually getting better. Pain's not really coming back. Functionality is even greater, preventing knee and hip replacements. So it's a really interesting field. We have a lot of experience with it now, and it's just been fun to practice medicine again. We were practicing sick medicine, now we're practicing well medicine again.
Amazing.
So there's your short answer.
So you hinted at like who can benefit from this kind of treatment, people who are dealing with pain in particular.
Yes.
So what makes somebody a good candidate for stem cell therapy for pain?
So great candidates are mild to moderate osteoarthritis. Knees, hips, minor tears, minor shoulder tears, meniscal tears, minor disc bulging, even disc herniations on some cases, degenerative changes of your spine or your neck. They're great candidates. Sort of easy orthopedic stem cells. We would either take them from your bone marrow. We can use anything in this office. We have cord blood, amniotic fluid, exosomes, which is a really new hot topic in the field, bone marrow. So there's a PRP, protein-enriched plasma, ozone therapy, where we can actually inject ozone into areas. So there's so many different things depending upon the condition, and we've learned over the years that not all products or treatments work the same. So you have to vary it from patient to patient.
You've mentioned cord blood and amniotic fluid a couple of times. Can you tell me just a little bit about how that is screened and done? Because we spoke about that before.
Yeah, so we only use 1 or 2 labs depending upon the time of the year across the country. Yeah. They're FDA-approved laboratories. They harvest cord blood within 5 miles of a hospital. This is very important because the stem cells are volatile. They could die very easily. So if you don't harvest it, if the mother has the baby and you extract the cord blood and it doesn't get in the right temperature control, by the way, which is in like an incubator, right away the cells are going to die. So laboratories that take care and harvest the cells right away, transport it in an incubator basically directly over to their laboratory, extract the stem cells, spin them down, and then cryogenically freeze them within an hour and 75 minutes. The viability of those cells isn't great. So a lot of people out there be like, well, stem cell didn't work for me. Maybe you used cord blood from a lab that didn't harvest properly. So it's really important to understand, this process, and this is ever changing. We learn about this constantly. We're going December 11th to the American Academy of Anti-Aging Medicine in Las Vegas for a week. So that's where all the greatest stem cell minds from across the country, get together and talk about, the newest developments in cell regeneration and anti-aging. So it's we're constantly learning and evolving.
Okay, I have a question for Jerry. So Jerry, can you tell me about the first steps for someone considering the art of pain management's therapies?
Yeah, obviously the first steps would be to reach out to us, right? What I try to do is answer as many questions as I can. I spend as much time on the phone or emailing back and forth with patients because at the end of the day, a lot of patients have a lot of questions. A lot of patients have some doubts about this, right? We're talking about trying to get people better with something that costs, has physical cost out of pocket. So my goal is to alleviate all the uncertainties as I can using the experience that we've gained by practicing and treating patients.
Terrific.
So reach out to us. I'll give you all the time in the world to ask questions. I'll get to know you, get to kind of figure out your lifestyle, what your expectations are for this. And then from there, we really want to get updated diagnostic studies. We want to see updated MRIs. Dr. Teller and Dr. Skeena are really great at figuring out what would prevent you from being a good candidate. There's clues, there's triggers in these MRIs that can really give us an idea as to whether or not you would be on the higher end of success or on the, hey, listen, it's more 50-50 or it's more like 30% chance of getting better. We'd rather know that before we, get to the process of the procedure. So that way, if you're not a good candidate and you still decide that's something you want to do, you did that on your own accord. We didn't pressure you. We're not salesmen. We're not here to try and blow you up to get you to do this treatment. We want to let you know with our experience how good of a candidate you might be, so that way you can make the best decision going forward.
Can you give me an example of a success story?
Yeah, I mean, one of our first knee treatments we did, they had one of the worst abnormalities in the
valgus deformity, where the knee would actually be like deformed. Like if you have osteoarthritis out there, you'll know the knee will start deforming or bowing out, right? So she was one of the first and did treatments on her 2 years ago, and now her knee is not deformed anymore. The meniscus actually sort of grew back, which creates that cushion back in the knee, and the deformity sort of goes away. Some other things that have been an incredible success are anyone with COPD. As a side note, the lungs are one of the first things to metabolize the stem cells, especially if you're doing an IV of stem cell exosomes. It goes to the lungs first. And for whatever reason, people with COPD that were on oxygen are not anymore. So it's actually saving lives with COPD. It's actually incredible. It was one of those surprise things, a byproduct, as you per se, a side effect, that lung tissue healed. So it's great. So we do a lot of COPD now because of it. And frankly, people with type 2 diabetes too. A1Cs are going down, people are using less insulin. Again, the kidneys get metabolized, right after the lungs. So, and pituitary glands goes there. It does cross the blood-brain barrier to the brain. We have a large population of traumatic brain injuries, post-concussion people.
And what about
strokes?
What about people who are in their mid-30s, 40s, and like the aches and pains that come with this middle age?
We love like that. That's kind of like who I am. I'm in my mid to late 30s now, and we always want to try and stay ahead of the curve with our health, especially now that we learned from our ancestors, we learned from previous generations about how to take care of ourselves better, and we want to continue that. Like I want to be 60 and be able to hike and run and do all the things that most 70-year-olds, 60-year-olds maybe can't do now, just because they didn't know over the years that they had to be doing stuff like this. So we love working with all age groups, whether it's young and healthy but want to stay active or be preventative. You find out you have a mild case of osteoarthritis, or you have some really bad tendonitis that's bothering you and you can't get rid of it. It's affecting your performance, it's affecting your daily life. Those are the kind of patients we love to treat, and as well as the 80-year-olds that just want to be able to walk around the block or be able to walk on the beach with their spouse. We really cover the whole gamut of treatments.
29-year-old guy from the gym 2 weeks ago, labral tear. Surgeon doesn't want to really do the surgery. One surgeon wants to do surgery, one surgeon won't. He comes in, PRP, stem cell exosomes. First treatment, second treatment, we're going to we use the Ozone bone marrow. He's fine. Labral tears. I don't know if it's gone yet. We'll wait a full year to get the repeat MRI because these cells will heal for up to a year. But he has no pain anymore.
How long was the period when he went from in pain to
4 weeks post first treatment? Pain was 80% gone. And then a week or two after the second treatment, he's had 100%.
That's incredible.
So we'll see what the labral tear actually looks like. We'll have a good pre and post.
Yeah.
Pre, and now we'll wait a year and get the post.
Fantastic.
So we like doing that. Jerry's been doing a research study for us where he's tracking all of our patients, success and failures, and we learn from it. We'll actually be posting that, I think, shortly, right?
Yeah, I'm working on putting together all the numbers. One of the things I think that really sets us apart based on other practices is we do take a very big research approach. Dr. Skina was director of one of Merck's research laboratories for many years, so research was always in his background, so I kind of learned from him and extrapolated that into what we're doing with this. And our goal is to publish our results after 5 years. So we're already in our third year now. So once we hit 5 years, we'll be able to publish a good 5-year data with pain scores, updated functional quality of life improvements, and then the empirical evidence, the 1 year pre and post MRI or X-ray, so we can see what physically changed in the joint in the spine, in the brain, in the lungs, whatever it may be. We want to see what changed over the course of that year to have that physical evidence to back up maybe some of the other type of
Can you show us around this procedure room a little bit? Can you just?
If you want to pan this way?
Yeah.
You can look real quick. This is a centrifuge where we can spin PRP, where we take someone's blood out and spin it down to the protein-enriched plasma. Here is an ozone machine, an ozone generator. Ozone can be reintroduced into the blood and then back through an IV, or it could be introduced into a joint itself. A cryo freezer, minus 82 degrees, where we keep cord blood, amniotic fluid, exosomes. They look like. Wait, do they have an open one? We might not have an open one, but they come pre-prepped and loaded. There's a complete genetic makeup on the donor of these for all the diseases and genetic abnormalities where there are none. So we know that these were all pre-tested and free of any contaminants. Diagnostic Ultrasound, one of the machines. C-arm, where we can video or take x-ray pictures and see where the needle's actually going. We have double C-arms just in case we're doing multiple areas. That's actually nerve ablation. We can freeze nerves, cryogenically freeze nerves for 6 months at a time. It's actually pretty cool. That's a regular Medicare, one of the regular Medicare procedures we do. Pain. Pain. So if someone has a lot of nerve pain, we can actually freeze the nerve. Pain goes away for 6 months or so. The nerve does regenerate and does grow back. So, but that's, if they do that and then get stem cells, right, get out of pain and then have the stem cells to help regenerate and heal the area, it's definitely worthwhile. We have a urine tox lab in the other room. I don't know if you want to walk over there and see it, but we can do that in a little bit if there's not any more questions.
Sure. Jerry, did you have something to add about barcodes with the stem cells?
So one of the things that I really like about all the products, right, we're buying them outside of the bone marrow product, which we'll get from the patient, but all these laboratories, they barcode and basically assign all these cells. So, God forbid down the road, if there's an issue, if anything were to ever come about, it's logged, it's tracked. It's not like you're just getting some random donated cells and, goodbye and good luck. This is assigned to you. God forbid anything would ever happen, which we haven't seen yet on our end. It's covered. At least we can track what was done. So,
very good. Yeah. And Dr. Teller, can you just tell me a little bit about pros and cons of stem cell therapy?
So, pros, healing. It has the potential to heal tissue and grow tissue. Pros are decreased pain level, functionality in life. Pros that I have seen with myself is recovery time. If I do a stem cell exosome IV once a year, my recovery time from lifting weights or playing squash or playing basketball used to be 4 or 5 days. I'm 46 years old now. Now it's a day and a half. Maybe sometimes 2 days at most. That muscle soreness you get after doing stuff, I don't really have much anymore. If I had some tendonitis in my left shoulder, Dr. Skeena did a little PRP, and the tendonitis sort of goes away. So they're all the pros. The cons, the price. It's expensive. So we always, joke in here that the only side effect is really to your bank account. That's it. The cells cost money. The kits to extract bone marrow cost money. It takes a lot of time to do a procedure, especially if you're extracting and spinning bone marrow. You're talking, 40 minutes, and then, looking and seeing the joint, and analyzing the MRI, and then, injecting the joint and making sure the viability of the cells is the right way to go. It takes some time, so it is expensive. There are no real side effects. The only side effect that we've ever really heard of was in some of the products we have used in the past, which we don't even use anymore. There was a preservative in them called DMSO, and you could get a small allergic reaction, like a skin reaction that Benadryl would have fixed within 30 minutes afterwards. And we've never actually seen it, we've heard it. The products we use now actually don't have DMSO in them. Our amnio product, our cord blood product, and our Ozone product doesn't have it today. So, as we was talking about bone, as we was talking about barcodes, our newest product, Ozone product, is actually donated from a 22-year-old man. We know who he is. It's always it was a fresh, each lot we get, each grouping comes from the same pre-screened person. He was 22 years old. He donated his bone marrow. They extracted the stem cell, and then what an exosome is where we extract the messenger RNA from the stem cell out. So that's where all those came from. So we know and the count's accurate. So we know we can give you 10 billion stem cell exosomes per vial. So we know we're giving you that, as opposed, and we also, there's some in there that has 50 billion. So it's really interesting where we can actually give you an exact count of stem cells or exosomes. With bone marrow, when we aspirate the hip, we know, we're probably getting between 15 and 20,000 live stem cells per aspirate, which is good. If we do a double aspirate, obviously we can get double. So it's pretty it's interesting. It's fun stuff. Actually.
You have shared so much information with us today. I'm really grateful for this time. So we're going to wrap up. Unless there are any other questions for the community, please feel free to chime in if you have questions. But we have a special offer for our community and our viewers today, whether you're watching the live or the replay. For the first 25 viewers to call in and mention Philadelphia Family, they'll receive a special gift bag. And Jerry, would you like to tell them about the offer that's in that?
Yeah, so the best part of the offer is, for anybody who's willing to give us their time and watch this and call and have questions and want to, they're considering this as maybe an option for them. We're gonna do it's a $1,500 gift certificate that you can apply towards any joint treatment, spine treatment, COPD treatment, neurological treatment, any type of treatment that we're doing. We can definitely apply a gift certificate for you, obviously spending your time with us.
Okay, so great. You can, to get more information, you can visit stemcellsphiladelphia.com and you can call 215-375-7107. So you can set up a time to chat, to meet with the doctors, and get to understand their holistic approach to eliminating chronic pain. Thanks for joining me, and I hope you have a great day.